Hello doctor. Here's a summary of postoperative delirium in oral and maxillofacial surgery, a scoping review article. Background. Postoperative delirium, POD, in oral and maxillofacial surgery, OMFS, has gained increasing attention due to advances in medical technology enabling complex procedures on elderly and frail patients. POD is a serious neuropsychiatric disorder associated with cognitive and functional impairments, but it is potentially preventable and manageable. The review explores the correlation between POD and OMFS, summarizing screening and management protocols and identifying risk factors. Methods. The study follows the scoping review extension of PRISMA-SCR guidelines. A systematic literature search was conducted across multiple databases for studies published between 2002 and 2023. The review included 68 studies after screening 644 articles. Data extraction focused on risk factors, screening protocols, management strategies, and the incidence of POD in OMFS. Result. Incidence and diagnosis. The review found significant heterogeneity in POD diagnosis methods, with reported incidence rates varying between 3 to 37%. The mean age of affected patients was 64.7 years. Risk factors. Identified risk factors span preoperative, advanced age, cognitive impairment, psychiatric disorders, alcohol abuse, low skeletal muscle mass, intraoperative surgery duration, blood loss, use of blood transfusions, and postoperative phases, ICU stay, delayed mobilization, insomnia, pulmonary complications. Screening and management. The study highlighted the lack of standardized screening protocols, with different tools such as CAM, CMICU, and DSM criteria being used inconsistently. Non-pharmacological prevention measures were recommended, but many studies relied on pharmacological treatment, including antipsychotics and sedatives. Postoperative outcomes. POD was associated with longer ICU and hospital stays, increased complication rates, delayed rehabilitation, and reduced survival rates. Discussion. The study emphasized the need for unified terminology, standard diagnostic criteria, and consistent assessment protocols in OMFS. The complexity of OMFS procedures makes communication-based delirium screening difficult. The review found that POD is often underdiagnosed due to the lack of structured screening and awareness among medical teams. Preoperative cognitive assessments could help in early identification and management of at-risk patients. Conclusion. Identifying patients at risk of POD preoperatively and modifying risk factors throughout hospitalization is crucial. Non-pharmacological prevention should be prioritized, and future research should focus on developing specialty-specific protocols. Standardized assessment tools, training for healthcare providers, and better documentation of delirium cases are necessary to improve patient outcomes. Thank you. Please like, share, and subscribe our channel to support us. See you in the next video.